the information that we give to the people, it can contribute to the vaccine hesitancy. So we have to be careful the information we dispense. Most of us here are learned or we are of a certain intellect, but the person or the intended audience, we have to be careful. So we have to try to keep the information as simple as possible and as relatable as possible for the audience.
Like, subscribe, and share to Voices of Linden TV.
Welcome to another edition of the Let's Talk Show. I'm your host, Andrew James, and today I'm pleased to have with us in studio a few friends from Guyana who will be talking about COVID-19 under the umbrella of health and wellness. I'm pleased to introduce a good friend of mine, Dr. Yohnatan Benjamin, Michelle Moseley, Brother Robert, Dr. Yohnatan Benjamin, Keenan Benjamin, Mr. Peter, and of course, Ryan Jacobs. We're going to get right into the show. Dr. Yohnatan, I know you're a doctor in Guyana and on the grounds in Guyana dealing with COVID head-on. Can you give us a perspective of what's happening on the ground, please, if you don't mind?
Thank you very much for the question. Good afternoon, everyone, and thank you for having me on the program. So I'm just going to give you some statistics of what's going on here on the ground in Guyana in terms of the numbers. So far we have 30,907 confirmed cases. Of that number, 14,716 are males and 16,191 are females. We have had about 754 deaths so far. So the number of deaths is rising. Overwhelmingly, most of the infected cases have been coming out of region 4, 14,761. And today, we have like 35 persons in the COVID ICU. On home isolation, there are 3,692 persons, while on institutional isolation, we have 180 persons. We're also noticing here in Guyana a lot of vaccination hesitancy among various groups of the population. The reasons for those, I'm guessing I think people haven't gotten enough information in terms of what the vaccines are, how safe they are, how effective they are. And I think some of that information will be given here today in this program.
Very nice to say. Thank you, Doctor. Next, we're going to move on to Keenan Benjamin in Guyana. Mr. Benjamin, can you tell us a little bit about aftercare and what it is that you're offering there in the town of Linden to post-COVID individuals, if you don't mind sharing with us, please?
Good afternoon, Mr. James, and good afternoon to the rest of the panel. Good afternoon to your viewers at large. I'm a registered physiotherapist working at the Linden Hospital Complex. And before we even get into long COVID, just a little bit about what is rehabilitation, because it's a very, very wide field. It's a very wide practice. So we're just zooming in on the COVID, but just to give a background into rehab, rehab is defined as a set of interventions, or it's the techniques that we use to help patients after injury or illness or deep disability. So as a physiotherapist, we work with a wide variety of injuries, whether it be musculoskeletal, neurological, whatever it is. We work with a wide variety of injuries. It just so happens that with the advent of COVID, that we have seen the importance or the need for physiotherapy and more so cardiorespiratory care in managing COVID-19 patients in the acute, subacute, and even in the long-term care of post-COVID patients. So with the new emerging phenomenon that we have, long COVID, we have different terms that people use to refer to it as. Some people are not comfortable with the term long COVID. So sometimes you would hear the term post-intensive care syndrome, or post-viral fatigue. I don't know how many persons are aware that the damage that is done to the lungs is permanent damage that is done. So sometimes the doctor would discharge and you would hear that you have permanent organ damage, or sometimes just simply long-term COVID. So long COVID is a new emerging phenomenon. We're still learning as we go along. We're still learning. I must say that we don't know much, and we're learning. So, but with what the symptoms, the signs, and these are for the viewers. If you have your friends and family that are around you and you notice any signs and symptoms, do reach out to get help. So, if you notice that they're suffering still with the breathlessness, chest pains, heart palpitations, fatigue, feeling faint or having fainting spells, dizziness. For those who have their own oximeters, they would notice that their saturation might drop from time to time, upon exertion or upon doing some type of activity. They would notice that their saturation drops. So all these are signs and symptoms of long COVID.
Benjamin. Next, I'll go to, we got a question coming in from Robert. Robert, are you there? Can you punch ahead with your question, please?
My question for Dr. Benjamin was, based on your statistics, what are some of the challenges you have in relaying those statistics to get the public more aware? Because what I've noticed is that in our culture, people don't really listen to facts. So what are some of the challenges that you're having?
Thank you for the question, Robert. Some of the major challenges we're having in terms of I think people being responsible is one of the major challenges, especially among the vaccinated. The vaccinated seem to think that because they have this vaccine, they don't need to mask up anymore. They don't need to sanitize, and they don't need to take all the necessary precautions that they were taking from before. And that is totally and completely false. Even with the vaccine, you need to avoid large gatherings. You need to wear your face mask. You need to wash your hands because there's something called breakthrough infections that can occur in the vaccinated, right? Another major challenge is vaccination hesitancy. A lot of people are asking, well, if I can still get COVID with this vaccine, why take it? Well, you take it because the system in Guyana, we don't have enough ICU beds to go through what places like Brazil went through and Italy went through, where people were lining up at the hospital, they weren't beds to put them on, they weren't getting oxygen. India ran out of oxygen at one point. We are a much smaller state, much smaller economy, and we will be overwhelmed way faster than those larger countries. So that's why you need to get the vaccine, because the vaccine reduces your chances of being hospitalized and reduces your chances of dying. So you can still get COVID while vaccinated. However, the likelihood of you getting so very sick that you end up in hospital is reduced significantly. The likelihood of you dying is also reduced significantly. I also think that another challenge is people are not getting enough information, or the sources they're getting their information from are kind of iffy. There's a lot of false information out there about the virus, that it can change your DNA and they can do all these things to you that are totally and completely false. And I was fortunate enough to watch the program, previous recording of the program with Dr. Yohnatan Benjamin, and he gave an excellent explanation, excellent breakdown of all that stuff that you guys can refer to if you need factual information. The explanation was perfect. So for the viewers out there, if you need to have some clarity, get information from a good source, I think you can refer back to that video for the explanation of how the virus works, how vaccines are made, the process they go through, and all of the vaccines that are out there went through those processes to be out in the market.
Excellent. Thank you, Doctor.
Just a question just before Dr. Yohnatan move on. Dr. Yohnatan, I don't know if it's a question that you can actually answer at this point, but I'm just going to throw it out there. Just out of curiosity, are you finding that there are a lot more unvaccinated deaths, or is this something that you cannot talk about? I will totally respect that.
No, I can't talk about it because this is public information. It's in the newspapers every day. It's on the news. Overwhelmingly, among the cases that that are dying, most of the persons are either unvaccinated or partially vaccinated, right? And we know that if you're partially vaccinated, your immune system cannot won't ramp up as fast as it would if you were fully vaccinated. So, yeah, largely, overwhelmingly, the numbers are showing that mostly unvaccinated persons are dying.
And in these unvaccinated people, are they seniors? Are they do they have pre-existing conditions? I'm just trying to kind of overcome some of the the comments that people will be making. So I just wanted to clarify that.
So you're asking if the vaccinated, the unvaccinated,
if the unvaccinated, did they have additional stuff, as well as from a curiosity level, as well as the vaccinated? Are you finding that the people that have pre-existing conditions are seniors
exactly,
as well?
Exactly, and that is also something that I think the public needs to know. Most of these vaccinated persons that have ended up dying had multiple
comorbidities.
pre-existing conditions and comorbidities. So even though you might be vaccinated and you get infected with COVID, the chances of you dying probably is higher because because of the fact that you might have other comorbidities and stuff like that. So it is still important, however, for people to I know that everyone has their reasons why they might not want to get vaccinated, and they're looking to their neighbors and their friends who are telling them all sorts of things. But pay attention to the figures, pay attention to the news. Overwhelmingly, the people who are dying are unvaccinated persons and mostly seniors. But that's not to say that we're not having persons under 30 years and under who are dying as well, who are not vaccinated. Children, we've also noticed that children now are getting infected and dying as well here in Guyana. And previously, when the pandemic previously started in its early stages, that was not something that we were so worried about like we are now, right? Children are dying and younger people are dying.
Question, Mr. Benjamin. Some of the services you spoke about earlier, the post-COVID care that you're offering in the town of Linden. Are those services free, and is there a way for folks who's interested in accessing them to access them, if you don't mind, please?
The services are free of charge. We do offer services at the Linden Hospital complex, or what they commonly call the Mackenzie Hospital as well. So you just come to the hospital and you tell or ask the folks at the gate or at the desk for the rehabilitation department, and they will direct you to the rehabilitation department. The hospital can be reached on, and you can reach us on, the number is 444-4953, 444-4953, and you just ask the switchboard to put you on to the rehab department.
Very good. Thank you, sir. Dr. Lawrence Benjamin, I noticed there's a question on the bottom there for you. If you don't mind, can you jump on that question? I think it's coming from my friend Peter. If you're able to possibly read it out, and if you can give us an answer, that'll be awesome, Doctor.
So the first question from Peter. Peter, thank you, and thank you guys for having me for a second time on this program. So the first question I have here from Peter is with the vaccines coming on stream in about a year now, I never went through the test of time for long and medium term effects. How can persons be certain that the vaccines will not affect them negatively? So I'll answer that one first. So Peter, this is a great question, and thank you for putting it out there. Just a quick on my background. I actually work in drug safety and drug and vaccine safety is what I do, and because of that, maybe because of being in this space, I think I can answer this question a little with some authority, more or less. So long term, yes, we don't have long-term data on the COVID vaccine specific because, of course, COVID-19 is only probably it's going to be 2 years in September since this month. It's 2 years this month since we have definitive evidence of it existing. So However, we have quite a long history of vaccines. Vaccines have been around technically since in the 1770s. So we know how this is not something we patch together with wires and spit and string. It's a solid platform. The mRNA research has been going on since in the 60s when it was first discovered, and so that got us for here with the mRNA vaccine. The adenovirus vaccines are the one with the viral vectors such as AstraZeneca, Johnson & Johnson, Sinopharm, and Sputnik. Those methods of delivery and those type of vaccines have been around for 40 years or more. So the other point I want to make here is, yes, we have a long history of these vaccines. The mRNA vaccines, even though the ones for COVID were relatively new, the first in human trial for mRNA occurred in 2013, which is about 7 years ago. And that is the information that was used to actually build these mRNA vaccines. Another point I want to make is with vaccines, and this is, we have an abundance of history to tell us this, the adverse events, long-term effect of vaccines, 99% of them are usually manifested within the first 14 to 30 days after you receive the vaccine. So that's why first of all, that's why the EUA was granted, is because they were still waiting and still going through the data to understand that. In Canada, we've fully approved all the vaccines that we have here. They're fully approved. There is no secondary approval waiting. They're not on EUA. They're fully approved. And Canada has one of the strictest regulatory approval process. As a matter of fact, I worked in the industry, and one of the complaints that we get is that the Canadian regulatory authority is so strict that it takes a long time for them to get through and they're very critical of data they receive. So Canada have approved these vaccines, so that gives me a very high confidence. I work with the people at Canada because of my role in drug safety, and they are very, very professional, and it gives me very high confidence that these vaccines are safe. And the long-term effect, if they do have any, because now we can't say 100%, it probably would be very minuscule. And again, because of the technology we now have that makes vaccines so much more targeted and more specific, the likelihood of anything devastating on the long term is even smaller. So that's the answer for the first question. Did that help, Mr.? Do you have a follow-up on that, Peter?
Dr. Benjamin, that was an excellent answer. I don't have a follow-up on it. I think you covered it well, and thank you.
Okay, thanks. So I'm going to go to the second question. Is anyone on the panel want to chime in or add anything to that?
Well, first, let me say, panel, once again, thanks for having me on, Andrew and everyone. I'm, of course, Minister Jacob, and I have been involved in this discussion for over almost 2 years when this pandemic started. Because I must say this, because I want you guys to understand that I've been a part of this discussion for a long time. I came into the knowledge about messenger RNA researching on the issue of going way back to the genome sequencing. And when you're going to invest in genome sequencing company, you had to do your due diligence. And upon doing my due diligence, I was able to read how it came to be messenger RNA. All right. And this was way before the pandemic showed up. I actually knew what the virus was and what the solution will be when I heard about the virus in China. I actually took some of my money just for disclosure. I told the wife, give me the little money, and we invested it in the vaccine company because I knew it would work. And I was saying to people the vaccine would look good, looking good, the data looking good. Look at the data, look at the hamster study. I knew about this from way before, etc. So I'm bringing some of the same level of knowledge that Dr. Lawrence has been sharing, and we pretty much agree on the efficacy of messenger RNA, the precision of that platform. What I am going to say regarding to that question, when we are given information about this platform, we must give balanced information. We must give the good side and we must give the bad side. And if you are seeing the people are saying there's a need for boosters because the efficacy is falling, that is reality, because that has been the only thing about messenger RNA that has been a concern for 10, 15 years, is how do we get it to maintain its efficacy? And so far, it's been very challenging. And now that they have deployed it into the field of viruses, it's very potent, but the issue now is how do we maintain it lasting in its efficacy? And that is, to me, is the other side of this vaccine that has to be clearly explained so people know that if they take it, they're going to have to take their booster and all of these things. We have to discuss that. You can't just glass that over, like if it's just misinformation, etc. So so to that particular question, and especially the one in terms of the drawbacks, if we're going to have this conversation, let's have this conversation, the good side and the bad side of it as it relates to this platform. That's all I want to say.
I noticed you said you talk with regards to the booster, etc., Mr. Jacob. And in layman terms, for everyone to understand, what are some of the concerns as it relates to why we should have a booster? I think if you can just kind of expand on that would be fantastic.
Great, Michelle. Great question. Well, the concern about boosters, and anyone, like I said, I've been at this for a while. So a year ago or more, I said they're going to need to be boosters for messenger RNA, because if you don't maintain the efficacy, when the vaccine dropped, and a month ago, and CDC had a panel review. Everyone has a phone. You can look these reviews up on YouTube, and you should watch every review that they're doing, because these are epidemiologists and doctors from around the world discussing what's going on with these vaccines. In one of their discussions, they clearly showed that when the vaccine efficacy dropped, right, in that drop, vaccinated people, if they don't get a booster, will be 2 times more susceptible for breakthrough infection. And we are seeing that with our eyes. All around the world, as vaccine efficacy drop, there are more breakthrough infection. And Moderna and Pfizer said clearly on one of those statements that they're expecting increased breakthrough and increased death because the vaccine efficacy is dropping and the virus is going to break through in those moments. If you don't take the booster, as the efficacy drops, you will be susceptible for infection, whether it's breakthrough or whatever they want to call it, you will be susceptible. So to me, those are some of the things that people need to know in layman's term, that this platform require maintenance of efficacy for protection long term.
People are behaving as though the booster is like, now they want me to take another needle, but in actual fact, the booster is something that could potentially increase the protection. Absolutely,
and that's why Dr. Lawrence, we'll get to you, but that's why I said on the other program before that my biggest problem is the overconfidence in vaccine. And Dr. Benjamin said it earlier, where people are partying, they're doing whatever they want because for some reason, people getting in their head, because I'm vaccinated, that means I'm protected, I can do whatever. And I said it when the CDC announced that vaccinated people are carrying the same viral load in their pharynx as unvaccinated people. I made a video and I said, the game has now changed. You need to go back to doing exactly what you were doing before, because that was a game-changing statement. And they knew what they were talking about because of what they were seeing out of Israel, etc. So I said it earlier, I'm going to say it again to anyone watching in Guyana. Please isolate your seniors as much as possible. Wear your masks, clean your hands, as if we have not come up with a total solution. Yes, this virus needs to wane down a little more, and these vaccines need to be given its chance to work itself into the population to stop other mutation that may happen.
So great point, Ryan, and nice follow-up, Michelle. I know that Ryan is very clear on the breakthrough infection and the waning of the protection from the mRNA vaccines. What I would like to do is actually put that into context, because there is this, and the anti-vaxxers are jumping on this to say, well, it's not protecting you, why are you taking it, etc. And Ryan, no offense, but partially it's because the way you explained it is giving that impression that this vaccine, that the vaccine, even with the waning protection, is not good. So first, let me put it in context. The US has vaccinated more than 181 million people as of yesterday, and that's based on the data we have. And if you look at breakthrough infections that end up that are either hospitalized or dead from that are vaccinated with predominantly the mRNA vaccines, you had just about 44,000 infection people who were vaccinated, fully vaccinated, that got infected. Now look at that into perspective. Put that into perspective. That is a tiny portion of 181 million. Yes, the people who got infected that were vaccinated, they had high viral load, etc. But when put into context, the vaccines, even with waning protection in the mRNA, are still outperforming the traditional vaccines such as flu vaccines, etc. So I think that point needs to be very clear. In Canada, similar data, we have similar data to confirm that based on data up to the middle of September, breakthrough fully vaccinated who are either hospitalized or dead or died with COVID make up about 1% of the total hospitalization and death. So again, that would show, even with all the noise you hear about the breakthrough infection, that it's just about 1% of fully vaccinated that are having these breakthrough infections. In Israel, which we like to go to as an example of the vaccines now working, it shows that even with the breakthrough infection in Israel, which is somewhat higher because, and they were predominantly just one vaccine, the Pfizer vaccine, you're still seeing a much better survival rate from once they get infected, and a much better control on the hospitalization. So we have to put this into context. Saying that there are breakthrough infections, yes, they are, but in the grand scheme of things, these vaccines are working really well, even with the waning thing. Now, when we talk about booster shots and booster, we have a lot of vaccines that have a similar model where you do have booster shots. You have polio, I think, you have tetanus, you have a whole lot of other vaccines. Dr. Yohnatan would be in a better position to tell you that, and the flu vaccine, which we have here in North America, we get a booster every year to fight the mRNA virus, which is the flu. So booster shot is not only because of the waning protection, which is actually not as bad as it's being projected. Booster shot is also to protect against the changing or evolving virus. mRNA virus change, it's their nature. They change. And the more people you have unvaccinated, that gives a platform for the virus to mutate, is the more it's most likely it's going to change. So yes, we more than likely will continue to have booster shot, given that a large swath of people choose to remain unvaccinated. But it's not because the mRNA vaccines are underperforming or they are not as good or something like that. But they are actually, even with waning protection, they are better than most other vaccines that have been in around for 40 years. So I just wanted to make this clear and put this into context, because I think without context, people get a wrong impression of these vaccines.
I think what happens when we are so informed, we tend to forget that there's some people standing foot on the ground looking at it horizontally, while we with the information are up looking down on this broad picture, and we have this kind of inside information to say that the general public does not necessarily have. And we need to be careful with how we relay that information. Context is always very important. I noticed you were mentioning talking a lot about Egypt, but Iceland is a great success story in terms of the numbers of vaccinations that they've had and what is happening there in terms of the low rate of death and hospitalization. Just 2% of the population has been hospitalized or died from COVID-19, and they're vaccinated. Right? Even here, the numbers are like 81% of the people who have died have been unvaccinated.
There you go. And
right.
Thank you.
All right, good discussion. Let's just bring it back together. I got a question there for Dr. Yohnatan Benjamin. The question is, for people who had COVID-19, why do they still need the vaccine? Don't they already have antigens that can fight off COVID-19?
So they have antibodies, right, that can fight COVID. However, the purpose of the vaccine, like Dr. Lawrence explained the first program I saw, is to train your body to recognize the virus and respond in a faster time than it would normally respond if you're having this virus infect you for the very first time. So after you get infected, it takes about 14 days, somewhere around 14 days, for your body to actually ramp up a response to COVID-19. However, with the vaccine, you're basically training your body to notice this thing. All right, this is foreign, this does not belong here. Recognize it, and so the response now comes in way faster than it would have come if you weren't vaccinated. And it's always better to have more antibodies, because antibodies are basically soldiers. The more you have, the better your chances.
The better the army is, yeah.
Right.
Excellent, good answer. Thank you, Doc. I got a question for Keenan Benjamin. Can we talk a little bit about the situation in the town of Linden without getting into too much of specifics in terms of vaccine hesitancy? If you're able to, Keenan, can you touch on that a little bit, please?
Sure. I'd want to basically just touch a little bit or just complement a bit of what Dr. Benjamin was saying earlier about the information that we give to the people. It can contribute to the vaccine hesitancy. So we have to be careful the information we dispense. Most of us here are learned, or we are of a certain intellect, but the person or the intended audience, we have to be careful So we have to try to keep the information as simple as possible and as relatable as possible for the audience. So, for example, in terms of the adverse side effects, when we want to give the negative or the bad, we have to let people know that even though these things happen, any drug, any man-made drug, or any medication that we take has side effects. You know, any tablets, everything, anything. Even you go for a surgery, there is a chance that something can go wrong. So any man-made intervention or so will has side effects. But we have to look at the benefits outweighing the risk at the end of the day. And tying in back to or relating back to what I do, if you're not vaccinated, we are seeing that there is a chance of, or you are placed at a greater risk of serious infection. After having serious infection, the toll on your body or the effects of the virus on your body will require you to need my services. But if you are vaccinated, the possibility exists you will not need my services.
Yeah.
So we have to let people know that there are benefits to taking the vaccine in spite of the risk.
Yeah.
And the benefits outweigh the risk. They say one in every 10 persons that has COVID or that gets COVID will suffer long COVID. 1 in every 10. This is not 1 in every 100,000, 1 in every 400,000. This is 1 in every 10 person that is hospitalized or even have a mild infection of COVID-19 will suffer long COVID. And these symptoms can present as soon as 3 months after, 90 days after the infection. Yeah. And I'm seeing patients coming now that 3 months after, 6 months after, 9 months after, they would have spent some time in the ICU, 11 days, 5 days in the ICU, but 9 months after, we're now in the long term, the long game now. And a year after, persons are still complaining. But with our help, thankfully, we realize that physiotherapy has its place. We're able to help them return to their quality of life or to that better quality of life. Mm-hmm. But I want people to know as a healthcare professional that the vaccine has its place. I have my role to play, but I want to let people know that the vaccine has its place as well.
Thank you.
And I think the best way that we can do that is if we as the individuals who have the reach, if we educate people, let them know the situation, relate to them in ways that they could understand. We gotta reach the people in ways that they could understand. Because if we don't do that, we
lose the message. We will lose the message. Yeah. And that's what I'm cautioning Mr. Jacob on. It's that you're informed and there is something as being as knowing your audience, and as someone who does this, and you have to know your audience and know how to. And I am not from Linden, so I speak as somebody that observes Linden, and sees the situation, and it's we have a task. It's a task, but I think it can be done. But we just need to coordinate. We need to be more direct. We need to be on the ground. We need to reach the people.
I get it, and I understand that there are some hesitancy, and I understand that for some reason or the other, politics have kind of crept into the conversation in mainstream Guyana. But I just want people to focus on the what is. The what is the information that Dr. Yohnatan Benjamin gave us, the stats. For a small country like Guyana to have that many deaths and rising toll of people being infected and people dying, and the stats for the unvaccinated people for the vaccinated, people to behave as though some or the other they are now superhuman. Dr. Lawrence Benjamin had alluded to this in our first recorded session, where the vaccine was not meant to make you superhuman, but it really was just meant to, to protect you as best as possible. I think the conversation here needs to focus on the what is. Are people dying? Are people getting sick? Are people having long-term effects of this virus? Yes, they are. Unless you can show me something that says no, they aren't, then the conversation really should be about yes, they are. And if they are, what are we doing in the interim? Did the government, did the CDC, did the health personnel, did they change information over time? Yes, they did. And I'll tell you the reason why they have changed information. They have changed information because as they have learned and uncovered something else, that information had to be brought out. Were they hasty in making some of those pronouncements? Yes, they were. And that's why they had to change. But we're all in a pandemic that no one has experienced before, not of this nature. And so, yes, information will change, most definitely. I think people need to understand that. It's not going to be static. It's going to be something that is going to evolve.
That's the point I was trying to make in the first broadcast, in the first program, is that we're dealing with an mRNA virus. We're dealing with a population that is inundated with misinformation that is driving vaccine hesitancy. We're dealing with political the political aspect of the pandemic management, and all of that is you have the layman trying to wade his way through this to get to the right information so that they can make the right decision. The right decision right now is to get vaccinated. We know that vaccines work. They work well. The ones we have work well. Now, if our target audience is a layperson, and we are trying to get that person, and as a healthcare administrator, and as a healthcare executive, one of the things I am following the same oath that Dr. Benjamin took, which is we do no harm. And I believe my entire 10, 15 years of my career, it was dedicated to drug safety, because I want to ensure that people get safe medication. We have post-marketing surveillance for that reason, is that information, because as you get, no matter how large a clinical trial is, it's a sample of the population. When you start using the drug in the real world, you have real world evidence coming in, which is technically a much larger sample size. So things that may not have shown up in your sample, in your clinical trial, might show up as signals in the real world. That is exactly what the CDC and everyone else who are making decisions to manage this pandemic is doing. We're taking real world evidence along with what we had before, and that is driving this. So we are making evidence-based decisions on how to get through this pandemic, and throwing other like red herrings into the conversation is driving more confusion for the layman. And I think that we need to be careful. We who have much more information than the person on the street need to understand how we can package that information so that it does not confuse them, and it helps them to make the right decision, which ultimately is to get the vaccine. So that's all I wanted to say, and I want to leave it at that for now.
And if I can chime in here, science is always evolving, and as things evolve, more information will come out. I don't know how many people know that in the 1950s, when the polio vaccine first came out, quite a few thousand people got infected with polio based on a vaccine that was given, right? But then they went back to the drawing board, came back again, and now we are able to eradicate polio. So people are looking at the vaccines that have been there before compared to this one, and they're making all these comparisons. Science is always evolving. New information will always be coming out. And all I am saying is, let's be careful with the information we give to people, because it can affect how they maneuver this entire pandemic and the entire situation. Things can get really ugly, especially for a small country like Guyana, which is my concern.
Very nicely said. I think we're just punching up against time, so we'll just do a quick wrap. I'll go to Keenan Benjamin. You want to give us your closing remarks, please, sir?
I just want to say thanks for having me be a part of the discussion, and It really was engaging, really was informative. And I'm really willing to, really work with whoever is willing to get the work done. We really have a task at hand to let people know what's going on, the situation that's happening in Linden. I think there's a lot of ignorance surrounding the situation, the COVID situation in Linden. There's a lot of misinformation, there's a lot of myths, there's a lot of conspiracy theories. So there's a major task at hand in terms of sharing information and sharing the correct information, reliable information. So I think we live in an age, as people said, of technology. Well, let's use that. So let's see how best we could use that to reach the people effectively.
Excellent. Thank you for your feedback there. Minister Jacob, you want to give us your last word, please, sir?
Yes, great. Thank you, guys. I must say, as a minister of the gospel who went around the world that serve humanity, I think ministers are people that care for the soul and the well-being of people just as anyone else, and we must always remember that. And as someone who invests in people in Guyana all the time, I do care about the people of Guyana. So my closing take is what I've been saying for almost 2 years. We are in a pandemic. The pandemic is of such that it requires us to protect ourselves. So I am asking the people of Guyana and people of the world to follow the social distancing measure. Please wear your masks. If they're older people, especially, if you can avoid letting them go to the market, and the younger people can bring food, etc. There's other steps that society has not been taken that could prevent a lot of things from happening to our people. So I have called on the churches over time to take responsibility for the elderly, etc. I believe that's the best thing we can be doing right now as we work through these vaccine rollout. I do think the data is still rolling in. I do agree. Science evolve. I believe God has given men knowledge, and we should appreciate scientists, doctors, and I do believe they're doing their best. That's my final thing.
Thank you, Minister Jacob. It's always nice to have your perspective. Robert, you want to take a closing word there quickly, please, if possible?
Yeah, first of all, thanks everyone. So I feel if you have a problem, you should be able to research it. You have enough information out there that you could learn from, ask the right questions. I think Guyana needs to come out of this say way of doing things and get a little more serious, especially about something like this that is so serious. I think that needs to happen. I thought it would have just happened overnight, but apparently, as Dr. Benjamin said, a culture shift takes a long time. So let's hope that it's slow but coming.
Very good. Thanks, Robert. It's always nice to have you on. Michelle Moseley, you want to give us your takeaway, please? Last word for a wrap.
Well, it's been engaging, just like the last one. Thanks everyone for coming on. Thanks, Andrew, for having me here on your program as well. I wanted to say a shout out to Dr. Yohnatan Benjamin and Dr. Keenan on the ground there in Guyana, young men who are doing their part in this fight against this pandemic, because we are in a fight. We're in a fight for so many people's life. The stories are horrific. Guyana is a small country, cannot withstand an outbreak of this magnitude. We have seen that. Dr. Benjamin showed the stats of at 35 people in the ICU, it's already at its breaking point. We don't want to see what the Delta variant could do. So how do we combat that? To me, we combat that by looking at what is available. If there is a vaccine that's available that you can use, do consider using it. But like everybody else has advocated here, a vaccine does not make you superhuman. It does not make you, that you're going to live forever. But what it does do in part is to give you that layer of protection. But at the same time, you owe it to yourself to wear your mask, to social distance, and to do all of the protocols, particularly washing or sanitizing your hand, do all of those protocols that were put in place at the start of this pandemic, because it's important. I go to work in an office. We do not commune in a general area without our mask. We sanitize. We do not have our office open to the public. People that come in, they come by appointment. They have to sign in. We do contact tracing. It is important to saving our lives. And, I really, really think that we should give that good, solid thought throughout our days.
Excellent. Thank you so much, Ms. Moseley. Peter, anything from you there?
Yeah, it was a good session. Good information being shared. I think Dr. Lawrence Benjamin is very resourceful. Provided a lot of good information. Thank you, guys.
Excellent. Thank you, Peter, for joining us. Dr. Yohnatan Benjamin, your takeaway, please.
Thank you all very much for having me on the program. It was a pleasure. I'm just going to say to those folks here in Guyana who might be watching this, if a vaccine is available in your community, please make the effort to go and get vaccinated. If you have any doubts or concerns, speak to your healthcare professional, the one that you trust and the one that you know. People tend to trust the people that they see on a regular basis. Find that person, ask them a question, get them clarified, and take a vaccine. If you need to go have a million tests to make sure that you don't have any comorbidities before you do that and get vaccinated.
Excellent. Good words of advice there from you, Doctor. Dr. Benjamin, you want to wrap it up? Bring the curtains down. Your last word, please, Doc.
Thank you. Thanks again for this spirited discussion. As I mentioned in the beginning, that in Guyana, we have a situation where we are in the precipice of it could result in tremendous hardship and heartbreak in Guyana. I just looked at the data that was released about 2 minutes ago by Mr. Derek Moseley. And in Guyana, today's data show that there are 8 deaths and 241 new cases. As you know, death is the last indicator. The leading indicator is cases. And as the cases go up, the lag indicator, which is death and hospitalization, is going to follow. That trend is really troubling in Guyana. And that said, as a country that does not have the resources as the US, where we can sit, or Canada, where we can sit back and say, oh, we want the DNA vaccines, or we want our vector vaccines, or Johnson & Johnson. We don't have that choice. And the difference in terms of safety, of the safety profile in the vaccines, are not that significant in terms of risk benefit. That means that any vaccine that is available in Guyana, should be considered as a prophylactic than the actual disease itself, than the virus, than getting COVID. And for that reason, I strongly recommend that we do get vaccinated, and because it's a part of the way out of this this pandemic. But also, when our hospital systems are overwhelmed, not only that the COVID patients suffer, but patients who might have a regular heart attack or something, or some other condition that is treatable. Something as simple as gallstone might not be able to get that treatment. And here squabbling over minor changes or minor differences in efficacy and safety does not help. So let's move forward, and the primary risk here is overwhelming the Guyana healthcare system. And one of the things that we can do, even though vaccine is not a panacea, it doesn't cure everything, it is actually one of the best tools we have in the arsenal to fight against this. So get vaccinated, and continue to you guys in Guyana. I can't thank you enough for what you're doing. I appreciate and working on with all the challenges. You're doing a great job, and continue to do as best as you can. and we will get through this. So thank you all. Thank you guys for a great and spirited discussion. Appreciate it.
Excellent. I want to thank our two doctors and our physiotherapists and all the other, our minister, of course, and all the other professionals that are on this call this evening. I want to show some love to Michelle Moseley, Robert, and Melanie Benjamin. It was their idea to start this presentation and get it going, and I think we would have been missed if I didn't recognize those individuals. On behalf of everyone at the Let's Talk Show, I want to take this opportunity to thank each and every one of you for being a part of the show.
Thank you.
Thank you all. I appreciate you. And Miss Michelle Moseley will be sending you your thank you little bags. Good night, everyone.
Thank you. Thank you, guys.
Thank you.
God bless.
Take care.
Thank you. Bye bye.
Okay. Thanks, everyone. Bye, everyone.
Bye bye.
Good night.
Good night.